torch infection, Toxoplasma gondii. It can be transmitted by cat feces or ingestion of undercooked meat. And in neonate, it can lead to chorioretinitis, hydrocephalus, and intracranial calcification. Also, the blueberry muffin rash is seen. In case of rubella, it is by respiratory droplet transmission, and in maternal, it can lead to rash, lymphadenopathy, polyarthritis, and polyarthralgia. It is a triad of cataract, deafness, and patent ductus arteriosus. It also has presence of blueberry muffin rash. And cytomegalovirus, it is by sex or organ transplantation, and it is usually asymptomatic in maternal, and neonate it has blueberry muffin rash, hearing loss, and petechial rash, and preventricular calcification. In HIV, it is by sex or needle stick injuries, and variable depending on CD4 count in maternal and reinfection in neonates. HSV2, it is by skin and mucous membrane transmission, and it is asymptomatic in maternal, and meningoencephalitis and vesicular lesions in infants. Syphilis, it is by sex transmission, and chancre primary and disseminated secondary stages of fetal infection, and it can also lead to stillbirth, hydrophobes vitalis, facial abnormalities, sabby skin, and cyanide deafness.